Hi, I'm Avantika. You're watching 9 Months and we are at Cloudnine Hospitals. Today we have with us Dr. Archana Kankal, leading obstetrician and gynecologist. Hello, doctor. Today we'll be discussing a few concerns raised by new moms on theinduspparent.com. So the first question that I have, doctor, is on hair fall, which is very common after delivery.
Yes.
Pushpa Pant asks, my hair has been falling like anything. What should I do to take care of my hair?
Okay. First thing you need to understand, Pushpa, that this is a very normal change going on in your body right now after your delivery. During your pregnancy, because of a lot of hormonal changes and specific because of the high levels of estrogen, your hair are in a growth phase for a very long time. Normally hair have their own growth phase and a resting phase. So in growth phase your hair grow, and in resting phase you have a hair fall. That is a normal change going on in your body. But during pregnancy, because of the action of estrogen, this growth phase is delayed and you get very thicker hair and very healthy hair during pregnancy. Definitely this change is not constant. So after your delivery, your hair are supposed to fall. The changes, the hormonal levels drop down. You will get more of a resting phase and more of a hair fall. This is a normal change going on in your body. Plus it is added on by lack of sleep, lack of nutrition, because during your pregnancy you were taking a lot of care of yourself. After delivery, the baby is the main concern. So you don't look after your diet, you don't get adequate sleep. So that will increase this hair fall. Just cool down, look after your sleep and your diet. Consult a good dietitian and this change will be transient. The hair fall also will reduce and you will get back your normal hair after few months.
Okay, Pushpa, you need not worry. All your hair is going to come back. Second question is again most important issue. I have put on a lot of weight, says Meera Nagpal, during my pregnancy. And I look the same as I was before my delivery. Moreover, I feel, during breastfeeding, I'm constantly hungry and I eat all the time. What should I do to manage my weight?
22 kg in 9 months is a bit more. So you are getting it hard to reduce that weight. So normal weight gain, which is recommended or which is advised by a doctor during pregnancy, is 11 to 12 kgs, sometimes 13 kgs is also allowed. But depends on your body mass index, so you have gained more than that. That's why it is going to take a little longer time for you to lose that extra kilos. At the time of delivery, you are supposed to lose at least 6 kgs because the baby's weight is around 3 kgs, 3.5 kgs, the placental weight and the fluid loss also. So you will lose these 6 kgs at the time of birth. But after that, the family makes you eat lot of ghee and lot of high calorie diet. So you must have put on another 6 kgs in those 3-4 months. So, but the main concern at this point of time is your baby, and baby needs to get adequate feed. So nobody will allow you a good dieting. But exercise is definitely a good relief in this situation because you are 4 months delivered already. So you can start a very good exercise regime which can burn up your calories. Normally we recommend...
How soon can she start exercising?
See, if for a normal delivery, a patient can start exercise immediately after delivery also. So immediately after discharge, she can start doing exercises. And after cesarean, when the pain factor reduces, say in 7 days or 2 weeks, she can resume basic exercises like walk. She can start immediately. She can start some basic stretching exercises also. But for abs and abdominal crunches and all those kind of vigorous exercise for the tummy, she needs to wait for 6 weeks.
Okay. Meera, make sure you consult your doctor before you start any kind of exercise regime. Next we have Pammi Puri, who says that somehow I am always depressed after delivery, and even though I am happy with my baby, I am not able to gel with him. Am I going through postnatal depression?
Let's not call this as depression immediately because first few days, say 10 days after delivery, you are going to get postpartum blues. These are specifically termed as postpartum blues. The reason is your hormones are dropping down, you are tired because of the process of delivery, and you are super excited also because you have seen your baby for the first time, you are taking care, as a new mom, you are learning a lot of things. So these are just because of anxiety and lack of sleep again, because you don't get adequate sleep. Diet also is haywire during this period. So this change is very normal. You will get back to normal in next 3 to 4 days with a supportive husband and a caring family. You will definitely come out of it. After 10 days, if this thing persists, you are not getting, you are not feeling happier, or you are constantly tearful,
Okay.
and something like that, you need a little counseling, probably best done by your own doctor, your own gynecologist, and adequate rest, good diet will solve this problem. If still you are not feeling better, then some of the mothers may need mild antidepressants, which are very transient, for a few months you have to take those medicines and you will be all right.
Binu Pal says, I'm having major problems breastfeeding as I have flat nipples. Please advise.
Flat nipples is a very common problem actually. It is actually need not be, you need not fear about it. We at birth, when your doctor checks and when the lactation consultant over here at Cloudnine, we always do a checkup prenatal and postnatal for the mother's nipples status. We give you a breast pump, which is a simple syringe cut on the backside, and we prepare a pump, and it's manually you can pull out the nipple and give that to the baby.
Okay.
Always remember that the best sucking power is in your baby's mouth.
Okay.
So just by fearing that your nipples are retracted and baby will not be able to hold it, you are not feeding him, that's not right. You have to try to feed him as much as possible. Every 1 hour, every 2 hours, try doing that. Even though the baby is refusing to take, you have to keep on trying, and once the baby learns to hold that, baby will definitely take out your nipples even though they are retracted. One more thing can help is a nipple shield. These are artificial nipples with made up of something silicone or rubber, and you can properly sterilize them, and they are also a great relief for a mother who has retracted. They are safe to use, but cleanliness has to be maintained.
Okay. Supriya raises a very important point. She has developed horrible stretch marks around her belly and pelvis after delivery. Can I get rid of them after delivery, or is it too late?
Oops, this is a difficult question to answer. There is actually no full and final solution for stretch marks. However, early you start the treatment, or even if you are late, the stretch marks are not going to go. Please accept that, because they are not some marks who have come from the outer part of the body. They are through the within the skin because of the breaking of the collagen fibers. So like if you pull a elastic, you can see the fibers of the elastic getting away through the away from the main thread. So skin also goes through the same change when it is overstretched during pregnancy. So it's very difficult to make the elastic as it was earlier before pregnancy. So it's very difficult to do it by applying creams outside. So a lot of preparations are available in the market, lot of things are there, but I think you need to accept that these are going to be there for permanently with you. You can definitely reduce them. The red marks are going to fade away into white marks, which are called stria and stria alba. So they are not going to look as ugly as they are looking immediately after delivery. And creams which contain aloe vera or hyaluronic acid act as very good moisturizer, keep your skin hydrated. Stretch marks won't trouble you too much.
Supriya, I'd advise that don't take them as your stretch marks, take them as your tiger stripes and be proud of them. Next question we have from Garima Agarwal. How do I make sure my baby is getting enough milk? This is very important. What should I be eating to make sure he gets the right nutrition?
Okay. So don't listen to anybody who comes into your room, peeps in and say, oh, I think you are getting less milk, or I think the baby is crying constantly because you are not getting enough milk. There are only 3 factors which tell you that the baby is getting adequate milk. One is the number of times baby is passing urine. Initially for first 2 to 3 days, baby might pass urine just for once or twice a day, but gradually baby starts passing urine every 5 to 6 times every day. Then the baby does motion for initially once or twice, and then 2 to 3 times in a day baby passes motion. And third indication, and very important indication, is baby's weight gain. So baby needs first 10 days of the baby's life, baby will lose weight. 10% of weight is lost because of the loss of water through the body. Then gradually the baby starts gaining weight. At least 150 grams per week baby should gain weight, and definitely the pediatrician over there here, lactation consultant we have in Cloudnine, will guide you how the baby will doing with the weight gain, and the lactation consultant also will encourage you. So I don't think any mother should assume that she is getting less milk till the pediatrician or the lactation consultant says so.
Pooja Pandey says, my C-section scar still pains even though my baby is 8 months old. How do I take care?
Pain is a variable symptom, I think. It is subjective also. So few patients are absolutely all right within a week after cesarean, and some patients may get little extra time, say 4 weeks, 6 weeks, sometimes 6 months also. Caesarean scar tissue contains more fibrosis, more fibrous element than the normal skin. So while bending or while doing some activities, you may get pain. Just don't worry about this pain. Even if there is a pain, your stitches won't open up, or there will not be any internal injury. So you can carry on all your routine activities with your doctor's advice, and just try to tolerate the pain. Gradually with exercises and bit of massage, the pain will get better.
Okay. Malini Singh had a normal delivery, and she says that even though my baby is 6 months old now, I have not got my first period. How long should I wait for it?
This is very normal. Mothers may not get their periods for a year also when they are feeding. Specifically when they are lucky, of course, but one thing they have to be careful, because even though they are not getting their periods, they might conceive. Because irregular ovulation is known in this lactation period. So contraception is a very, very important part. Other than that, don't worry, your uterus is not gathering any collections or some dirt inside, nothing like that. You can just wait and watch for your natural periods, but you have to use good contraception. That's important.
Okay. Anu Sharma has mastitis, so she wants you to give some suggestions on how to deal with it.
Mastitis, yes, it affects almost 10% of delivered mothers, and the commonest reason is getting engorged breast and not having awareness about expression of milk. I always say that there has to be a coordination between the demand and the supply. So initial few weeks, the baby's hunger is not that much. Baby takes a little less secretions, and the mother gets more secretion, and this may cause engorgement in the breast and may sometimes lead to mastitis, because sometimes the bacteria may travel through the cracked nipples and may cause an infection in the mother. The first sign is redness in the breast and pain. At this stage, if it is detected, expression of the milk and some mild analgesics and antibiotics will definitely take care of the infection.
Okay. Priyanka Talwar raises a very important point again. She is breastfeeding for the last 6 months, and she wants to make sure that she is getting enough calcium.
So we usually recommend after delivery double the dose of calcium which she was already taking. With that, she has to, for at least 6 months, she has to take calcium tablets supplied with vitamin D3 as well. And in her diet intake also, she should take more dairy products, ragi and all those things, which will make sure that she is taking enough calcium.
Thank you, doctor. Thank you, Cloudnine. Hope all your concerns have been addressed in our show 9 months.